Okay, so today is November 29, 2010. This is approximately 1 year after your ketamine coma. What's really important is that you, right after your coma, you came here, and that's about, almost a year ago. And you had a booster, and you've had none since then. But you've also had an insult that exacerbated your RC. You got into an auto accident, okay? Mm-hmm. So, but you haven't had any boosters, and I would have expected you to have had one by now. And so what's happened here is what I would have expected, is that you've had some significant deterioration, okay? Okay. We did your pain thresholds just a little while ago, and you got pretty severe allodynia that needs to be treated. And I've also indicated to you, based on the 3-day ketamine treatment we did on you, that you're probably going to need 4 days, because your dose response curves for your pain thresholds were improving after 3 days, so we would expect them to even be better after 4 days. Okay? Okay. So a 4-day infusion is probably going to be a great benefit to you. Okay? And just so everybody is aware of the fact, the outpatient ketamine treatment has been proven effective in 2 well-controlled studies. And of course, unlike the coma, which you've been through, we use the dosing and the route of administration of ketamine as it was approved by the Food and Drug Administration here in the United States. Okay, having said all that, what we need to do now is kind of go through some functional testing with you to see how you progressed or have actually gone the other direction. So I want you to take that right hand, put it over as if you can put it behind your head as best you can. See how far you can get on that. Okay? All right, fine. Now, compared to your 9-month evaluation post-coma, no, 8 months, sorry, 8-month post-coma, you've deteriorated there. So now let's take the other left side, see how far you can get with that. Again, there's been deterioration there as well. Take that right hand out in front of you, open and close your hand as fast as you can. Fast, fast, fast. Okay, that's the best you can do? Mm-hmm. Okay, now go over here and do your left, please. Fast as you can? Good. All right. Now, the next thing we want you to do is do the vertical finger test. You know what that is? Take 2 vertical fingers, see if you can get those in your mouth. Look straight ahead, don't look at me. See if you can get them in your mouth. Can you get them in there? Doesn't look like you're going to get them in there, do you? You having pain when you do that?
Yeah.
All right, where do you feel the pain when you do that?
The whole.
Is it worse on your right or your left?
Right.
As usual. Okay. Now, next thing we want you to do is, you had this really allodynia that would actually, we had it shrink down into the forearm, but now it's managed to work its way up into your arm. So just take your left hand and show us where the allodynia is. So just barely touching yourself right underneath your sleeve there is now painful. Is that correct? Like road burn. Am I correct on that?
Yes.
Okay, good. All right, now the next thing we want to do here is we want to get you up and check your legs. Before we do that, however, I want you to take that right foot up and just rotate your ankle for me, please. Rotate it as best you can. Okay, wiggle your toes for me. Hitchhike back to Philadelphia. Can you do that? Pennsylvania? No, can't do that. Okay, rotate your left ankle for me. Can you do that? Okay, wiggle your toes for me. Got a little better action there. Can you hitchhike? Get that big old toe up? Yeah, you can do a better job there. Okay, now, Patricia, what I want you to do is I want you to get up and go by the door, please. Take your time. We want to see what you can do. Atta girl. There you go. And your husband's going to be standing right behind you, okay? Just in case you need him, he'll be there, okay? Atta girl. Good job. Good job, Patricia. Now, Patricia, can you walk at all without your cane? And your husband will be behind you just as a safety net. Because I want to see what you can do on your own, okay? All right, he's there. All right. Okay, let's see how you're walking. There you go. One more step, one more. That's good. Now walk on back to the door, please. Walk on back to the door, okay? Now, I want you to hold his hand, and don't use him unless you need him. I want you to take 3 steps on your toes. Hold her hand for her. See if you can take 3 steps on your toes. Can you do that at all? Let's give it a try.
I can't do it.
You can't do it? Okay. If you can't, you can't. That you can't do it, correct?
No.
Okay, how about your heels? Can you take 3 steps on your heels? You can't do it? Oh, there you go. You got a little bit out of that. But you're bracing yourself on the door because you can't do it by yourself, can you?
No.
Safely. Okay, one last thing here and then we'll let you go. You can let go of her hand there. Okay, you see that black stretcher over there? Can you see that from where you're standing?
Yeah.
Okay, I want you to take and put your cane down for a minute, and I want you to leap from there onto that. Patricia, what? You can't do that?
No.
Oh, I guess we'll have to, I guess we have to not ask you to do it then, huh? Okay, go ahead, have a seat. Okay, Patricia, it's pretty clear what you need, and you need it pretty quickly here, and that is you need to have an outpatient high-dose ketamine infusion. And in your case, because your dose response curves were improving after 3 days, I would expect you to do better if you had 4-day infusion. We talked about that. Do you have any questions for me?
No.
Okay, let's go over here and see if your husband has any questions.
No questions here.
Okay, very good.